New York Times chief Africa correspondent Declan Walsh has been reporting what this outbreak looks like live on the ground in the Democratic Republic of Congo. Take a listen.
When we walked into this Ebola ward, it was very striking that in this confined space, you had a grown man being treated, you had this young child who just arrived, and you had a person who had died of Ebola lying in that same space. The hospital doesn't even have the resources to feed patients. People's relatives have to come to the Ebola ward just to bring them bottles of water and food.
Declan Walsh joins us now from Bunia, the capital of the Ituri province in the Democratic Republic of the Congo, which is the epicenter of this Ebola outbreak. It's great to speak with you, Declan. Thank you very much for being here. We see you in that video. You're wearing a Tyvek suit. You have PPE. It's clear that those visiting patients in that medical facility do not have Tyvek suits or PPE. Can you just talk about the capacity of this hospital to deal with what is still a nascent outbreak in the DRC?
That particular hospital was, I would say, completely overwhelmed when we arrived. It's the main public hospital in a gold mining town called Mongbwalu that's about 50 miles north of here. That's where this outbreak is believed to have started, and as long as 2 months ago. And when we arrived there, frankly, the public health facilities appeared to be in crisis. As you see, there was only protective equipment for medical staff like doctors, but otherwise those wards were not secured. There was very minimal care being given to patients. And then you had relatives and other folk just walking in and out, and they seemed to be entirely unprotected. And of course, that was putting them at great risk, and of course, increasing the possibility that the hospital itself would be a source of transmission back out into the community.
Yeah, it looks, I mean, it makes sense now that you're saying that's the general hospital, because it looks to me like TB wards I've been in places. It doesn't look like a purpose-built facility, which I guess is part of the problem. I do want to ask you briefly how you got there, and then David was pointing out to me earlier this morning that you said that you hadn't really planned on going in to this extent. Why did you change your mind once you were on the ground?
We were there for several days. We'd spoken with the medical staff, got their permission. We got the permission from the patients to enter that ward, and you know, I just felt it was very important to witness firsthand and to show the reality of care in the Congo, particularly in this frontline area. Here in the main city, Bunia, the head of the WHO has been here the last couple of days. Dr. Tedros Ghebreyesus. There are, 8 agencies are present here. There's certainly some supplies coming in. I was at the opening of a new isolation ward in the city this morning. But up there in those rural areas where the greatest number of cases are found, for a whole combination of factors, it's extremely difficult. Very little aid has reached there so far. And, they're in a crisis situation, which of course is bad, terrible news for the people who are already sick. But it also means that the spread of this virus is frankly unknown and probably still uncontained.
Declan, something we've spoken about with Jeremy Conondike, public health official from the U.S., with Tom Frieden, former head of the CDC, as well, is just about the cultural difficulties here, conveying to the population the seriousness of this outbreak. And you point to something very worrisome in your piece. You say many refused to accept the virus was real. You continue, some said the outbreak was a money-making plot concocted by Congolese doctors and foreign aid workers. Others call it a curse. As we talk about the deficit in the public health response to this crisis, how acute is this problem in particular, just conveying to the population how dangerous this is and trying to explain in light of those sense of what's happening here that in fact is not the case? This is a very serious virus.
It's an absolutely crucial point. When you speak to aid workers, the first thing they'll tell you is they need equipment. The second thing they'll say they need is education and engagement with these communities. Some of these communities are extremely hostile to the virus. It's not just, to the idea of the virus. It's not just that they don't believe it exists. They have carried out attacks against hospitals. The hospital that I visited had an isolation ward that was under construction, burned down. It came under attack the first night we were there from a group of over 100 people who wanted to retrieve the body of a local spiritual leader who had just died of Ebola. And what that all gets to is the whole practice of funerals. I think, as you noted, the body of a person is most contagious at the last stages of the disease and after they have died. So how the dead are buried is absolutely crucial. Otherwise, funerals can turn into super spreader events. So you see these really courageous local health workers and Red Cross officials who are doing their best to educate people to try and carry out safe burials of bodies. But because, frankly, the effort is so far behind the curve, as I said, this outbreak is thought to have started probably 6 weeks, maybe 2 months ago, but was only discovered and declared 2 weeks ago. So the entire effort is far behind the curve, which means there's very little reliable data about how much it has spread. And that's only feeding into this suspicion among local communities who, as far as they're concerned, see people going into hospitals just to die.
Declan, I also want to ask you, I want to focus on something you talk about because you report that the hospital has no food or water to give to ailing patients. This is consistently an issue with healthcare in places like this. I know when you're giving HIV medication, when you're giving tuberculosis medication, when you're giving supportive care, that supportive care can't work if your patient is malnourished or you don't have clean water. And it's often the part of the response that it seems to get lost in the shuffle. Are there any efforts being made to address that piece of this? What is needed and where do you think it should be coming from?
Look, certainly the World Food Programme have mobilized in this area. They're mounting feeding programs and so on. But, there are two issues with that. Firstly, as you say, in a hospital like this, they just don't generally, for normal treatment, provide food or water to patients.
The families are generally responsible for bringing food to their patients, right? Yeah.
They come in, they provide the food. Now, that is providing a biosecurity hazard in this environment because family members come in unprotected to provide food to people and run a high risk of being contaminated themselves. The other issue is in terms of people's ability to fight this virus. Because this virus it's a rare virus that as yet has no vaccine and no cure, the only way to treat it really is to bolster the defenses of a person who is sick in order that their own body can fight that virus. And obviously food, water, IV drips, all of these very basic, not even medical treatments, but certainly basic things to bolster their immune system are key. And that's why if the medical authorities are going to successfully start to push back this wave of infections, they're going to have to get those pieces in places as well.
Yeah.
Declan, let me ask you lastly just about what you heard from that Congolese doctor with whom you spent the most time. And I think in circumstances like this, past outbreaks, the frustration and exhaustion are palpable among the medical staff who are in facilities like this one. How would you assess his level of optimism that this is going to get under control? And indeed, what does he need, or what does he say that he needs going forward?
I think firstly, he just wanted protective equipment for the staff. Secondly, he wanted to be able to secure that hospital so that they could work in a safe environment. When I met that man in the ward, the young doctor, he was just not just exhausted. He'd just come off a night shift where someone had died during the night. A lady fell into a coma and died. But he really felt like he was at the end of his tether. He said, we're almost 2 weeks into this crisis, and this is all we have. How is it possible that both my own government, but also this international system that has, deployed to so many of these Ebola emergencies, he was basically saying, why is that not here? And that kind of frustration is palpable among many of the healthcare professionals you meet in some of these frontline areas.